August 31st, Channel 3 needs your help to clear the shelters.
Adopt a pet or donate online to help your local shelter heroes and animals like me. To learn more
or donate, go to cleartheshelters.com.
Channel 3's Cindy Sexton, coverage you can count on.
Welcome back to 3+U. We love when this guest comes in because the information is phenomenal. Dr. Michael Hernandez is with the Chattanooga Dental Care, and you guys, one of the things that you feature, and we'll talk about general dentistry also, but dental implants is kind of a huge thing now, and it seems like it's the next wave, the revolutionary thing in dentistry. Do dental implants, does that basically replace dentures on some level?
They can. Yeah, we can use dental implants for lots of reasons, but if you already have a denture, and you don't like how your denture fits, dental implants can help tighten the fit of your denture, just make it so that your denture won't flop out when you're talking to someone. Or
talk about the difference between the two. How does a denture work briefly, and then how do dental implants work and the difference?
Sure. If someone is missing all of their teeth, we can make them essentially a replacement for all their teeth. It's what we've been using to replace someone's teeth for dozens of years now, a denture.
And if that happens, then a lot of times some of the teeth have to get pulled and taken out so that the false teeth can get put in, right?
Right. For a full denture, it's actually when someone doesn't have any of their natural teeth remaining. And it's a piece of acrylic that's molded to look like your teeth and to look like your gums. And for the top, it fits in and it's held in somewhat by the suction that's created. And for the lower, there's not really anything that kind of holds it in. It's just sitting down there. So
really,
what we tell patients is if you considered your natural teeth to be 100% of your function that you can use your teeth with, a denture on the top would be around 30%, and a denture on the bottom would be about 10% of the function you once had.
I did not know it was that low, quite honestly.
And that's the amazing thing about implants. They can raise that back up to close to 100%, between 90 and 100% of the function you once had with your natural teeth.
And when we say implants, describe how that works. How do they, because it is kind of a permanent solution. I mean,
Right. So let's take, for example, someone unfortunately has to lose a tooth. We can place a dental implant. It's a titanium post right back into the bone where the tooth was, and that heals back into place. And once it's fully integrated into the bone or healed into the bone, we can place a new tooth on it, a crown, a dental implant crown.
So, and even if the crown breaks, you don't have to go through the whole process again, right? You'll just replace that crown.
Correct. Yeah, the crowns are pretty sturdy. They usually don't break, but in a situation where a crown would chip or the implant screw that holds the crown into the implant itself, if that were to fail, we can usually fix it without having to go through removing the implant and replacing it.
Well, is there any are there any negatives, any side effects, what's a reason that somebody that may be in need of a dental implant might not get one?
Possibly that they don't know much about it yet, but we can definitely inform them about it at our office at Chattanooga Dental Care. It's really the greatest thing for if you're missing a tooth or missing multiple teeth. It's the best thing we have for replacing your teeth.
So could someone literally do an entire mouthful of dental implants, or is it not designed for that as much as maybe 1, 2, or 3 teeth in your mouth?
No, we can do as many implants as are needed to replace your teeth, and then depending on which way you want to replace your teeth, there's kind of multiple ways to go. But we would talk about that at a consultation with a patient and discuss with them their options.
Talk about pain level. I've seen videos of it being done, and it just looks like painful because you're literally screwing or drilling the post, as you call it, up into, I guess, the bone above the gum, and it sounds horrendous.
It can look a lot tougher in those YouTube videos. I've watched some of those YouTube videos for surgeries, and they're kind of, but just like in the surgery, you're asleep. For the dental implant, we can either sedate you, or if you don't want to be sedated or you can't be sedated, we use local anesthetic, just like when you're having a filling. Many more people have had dental fillings, and you don't feel anything in that situation, or you shouldn't. And just with the implant, we numb you up. You shouldn't feel anything. Sometimes when the implant is going in, there's a little bit of pressure, but that can be kind of controlled with the speed that we place the implant in. If you're feeling a little bit of pressure that's uncomfortable, we can kind of slow the process down, but you shouldn't feel anything painful.
And can people tell, sometimes you can tell if somebody's wearing dentures. Can people tell when you're wearing dental implants, or does it have a natural look, or does it have an almost really good, awesome look?
No, it looks very natural. For most people, you shouldn't be able to tell that they have dental implants unless they told you about it.
And is it something that is, once they're in, you don't worry about, like literally 5, 6, 7 years could go by and you don't think about them once at all?
Right, that's right. The success rate for implants is in the high 90%.
Really?
Nothing is going to be 100% incapable of going wrong. Just like your natural teeth, something could go wrong with your natural teeth. Something can go wrong with your implant. Those kind of situations we can discuss more in the dental office, but they're pretty rare. Dental implants really are the greatest thing for replacing your teeth if you need to.
Well, let's back it up. They're great for replacing your teeth if you need to. I think the number one choice is not having to have your teeth replaced.
Right, exactly. We're talking about percents of how good things are and their success rate. Nothing is going to be as good as your natural teeth.
So let's talk about protecting those. My grandmother-in-law, the scariest thing for her was losing her teeth. And until the day she died, she took such good care of them. Every tooth in her mouth was perfect, looked good, healthy. How do we do that?
That's wonderful. So the main thing is what we are always telling patients is brushing your teeth twice a day, flossing, and reducing the amount of sugar in your diet. Those three things can really reduce the risk of you having cavities and losing teeth.
So the sugar in the diet, is that, I mean, if you're brushing 2-3 times a day, is the sugar in the diet okay, or is it still going to be harmful?
You can have some sugar in your diet. We don't tell people to completely remove all the sugar from their diet. There are some natural sugars in your diet that can also contribute to tooth decay, but those come from healthy foods like fruits, mostly fruits are where you get a lot of natural sugar in your diet.
And I actually don't eat a lot of fruit because of the amount of sugar.
Oh, okay.
Which is probably you need it for something, but I'd still avoid it. So other diseases, a healthy mouth, and I hear this all the time, means a much healthier body. Talk about the relationship between bad tooth care and other illnesses with the body.
Sure. Studies are finding that the bacteria in your mouth, especially if you have a condition called periodontal disease, which is an advanced form of gum disease or gingivitis, that bacteria and the inflammation that it causes can be a negative effect towards your overall health, especially your cardiovascular health, your heart health. So we are finding systemic links to your oral health in dentistry.
And you know what I think? I think most people are probably guilty of this. So you brush your teeth in the morning, of course, mouthwash, floss, whatever you do. But at night, you're so tired, and you know what? I'm not worried about it.
Yeah.
And you get into a habit of never brushing your teeth at night.
Yeah.
And so all night long, everything from that day is just sitting there. Is that pretty typical of what you see?
We see that sometimes, and you described it perfectly. So if you're not brushing your teeth at night, I'd actually rather you be brushing your teeth at night than in the morning, even though you probably want to brush your teeth in the morning so you don't have bad breath. But all the food that you've eaten during the day and anything that has remained on your teeth, that stays on there all night. And then you create what would be for most people a normal amount of saliva during the day. You're not drooling at the mouth, but you don't feel like your mouth is very dry. While you're sleeping.
I'm really hyper aware of it now, but thank you,
Now
Doctor.
that we're talking about it.
Keep going.
While you're sleeping, you create very little saliva, so the saliva is there to kind of wash away things that are on your teeth, and that's not happening while you sleep. So if you don't brush and you have some food particles or some plaque on your teeth, that's really doing its work at night and potentially causing dental problems for you.
I want to go brush my teeth now. And you answered something for me that I've actually thought about before. Why don't we, because we're making saliva, why doesn't it just run out of our mouths, but we're not making it at night when we sleep?
Right. It's very, very little. It's very reduced.
Amazing.
Yeah, you're making a small amount, but not very much.
Dr. Michael Hernandez, guys, you got to. I'm telling you, whether you just want looking for a great dentist, this is the guy you want. Michael Hernandez, Chattanooga Dental Care. I've got the number 499-9300, 499-9300, and ChattanoogaDentalCare.com is the website. You can find out more about dental implants, mouth care, health care, teeth care. All of that is on the website as well. Doctor, thank you so much, and you stick around. We're going to have much more 3+U right after this short break.
Thank you.
I always like to stay inside the car. We can be loud and nobody tells us to be quiet.
That is a shoulder compliment.
Nobody's judging you for what you order. You can get one of everything if you want.
When you're in the truck,